everyone, and welcome to the FLATLINING Podcast. I'm Matthew Handley from FLATLINING.net, and with me is our president and CEO, Ron Howergan. Ron, how are you, sir?
I am good, thank you.
Now, if you're listening, you may hear Ron sounds a little different this week, and that's because he is traveling. Ron, you're down in Alabama, and what are you doing down there?
Yeah, I'm down here in Mobile there's a MGMA professional development meeting tomorrow, and I'm going to be one of the speakers and doing a speech on payer activities and sort of how they act, and it's aptly called Tales from the Dark Side.
You know, I was just about to ask, is there any good payer activities that you're seeing right now?
I'm sure there are. I just haven't seen them.
It's like a unicorn then, you know. Everyone knows what it is, but no one's seen one.
That's right.
Well, you're listening to the FLATLINING Podcast. This is where we have great healthcare conversation and discussion. We talk about news, healthcare issues, and things that are happening in the payer world, especially the kinds of things that affect our clients. And one thing, Ron, that I know I have heard from a number of my clients, I know you have as well, is the fallout from the Change Healthcare cyber attack. For those of you that need a little bit of a refresher, there was a cyber attack against Change Healthcare, which is a subsidiary of UnitedHealth Group. Change Healthcare, it's sort of a way that providers get paid and how pharmacies process prescriptions, right, Ron? Can you give me a little bit of a primer on what Change Healthcare is?
Yeah, it's just that. It's kind of an electronic clearinghouse. So if you think about whether it's a pharmacy or providers submitting claims and then receiving reimbursement, all of that electronic exchange, it'd be like if you went to an ATM to get money out and the network was down and you couldn't access your accounts. It's that sort of electronic clearinghouse between providers of servicing and the payers.
Yeah, and so what we've been hearing from our clients and what we've been seeing from providers across the country is that they haven't been able to get paid in some instances. Well, this has taken a big hit to UnitedHealthcare. No surprise there. Their UnitedHealth Group's total revenues in quarter one of this year were $99.8 billion, and that is up 8.6% year over year. And in 2023, it was $91.9 billion. But the company overall, Ron, has posted a $1.4 billion loss following the Change Healthcare attack. You're an economist by trade. Tell me a little bit about what this means for UnitedHealthcare and what some of the other payers might be looking at right now as they're seeing United take such a beating over this issue.
Well, there's a couple of things here. I mean, anytime you report that kind of a loss, so over $1 billion loss, you should take notice. Now, to put it in perspective, last year United made $20-some billion of earnings, and so they could easily absorb a $1 billion loss. The big thing for me, though, is when you think about, is this a horrible day for the company? Is it going to drive the company under? All that stuff is to look to see how Wall Street reacted to it. Because Wall Street really reacts from the perspective of, is this bad looking forward? Does this create doubt for the company? And actually, their stock price went up by 4%. And what that tells me is, first of all, Wall Street knew there was going to be a hit, but they also knew that United will recover from this hit and that the hit isn't nearly as big as what they thought it was going to be. So anytime a company posts this kind of a loss, but their stock goes up, it means that this really isn't that bad. I mean, obviously, no one wanted the Change Healthcare cyber attack to happen, but this is not an indication that United's business is in some way in jeopardy. If anything, the opposite.
From a public perspective, I mean, obviously it looks bad with Change Healthcare. It looks bad to a lot of lay people saying, well, you just had this big problem. You can't pay doctors. You're still making billions of dollars. What does this do for the public perspective? Are we going to try and see United, do a save face kind of PR measure here in the coming months after this whole thing? What do you think we'll see?
It's interesting. I mean, other companies, you look at Wells Fargo and some of the trouble they got in and then what they try to do after it, do that sort of, hey, PR campaign to try to get their image back. I don't think United's going to do that. to be honest with you, I don't think they care that much about their image. I was reading something that their CEO was testifying before some congressional hearing, and actually had the audacity to say that it was a good thing that United had bought Change Healthcare. And his logic just really struck me as interesting. First of all, he said if United, even if United hadn't bought Change Healthcare, this cyber attack would have happened anyway. Well, I don't know that it would have. I think, the folks who were issuing the cyber attack, maybe they went after Change Healthcare because it was owned by United and part of a bigger organization. If you're looking to extract dollars, your pockets work. But the second thing that he said was that because it was owned by United, the attack would have happened anyway, and Change Healthcare wouldn't have been able to recover as quickly. And part of me said, "Oh my God, you think you recovered quickly? You were down for weeks. This was not a one-day problem. This was not a two-day problem. This wasn't even a one-week problem. This was you were down for weeks." And then the other thing that I think of is, wait a minute, as Change Healthcare is part of this big conglomerate that could still make money in other areas and obviously didn't face the wrath of Wall Street because of this attack, if they had been their own company and just Change Healthcare, I think they would have had more incentive to respond quicker than United had, this was one of many divisions, and didn't even really bother Wall Street that much. So I think their hubris, if you will, as shown by their CEO's testimony that, well, you should be glad that we owned it, otherwise it would have been worse, which I think flies in the face of logic.
Right.
Tells me that I don't think they're going to try to save face because I don't think they need to, which is really concerning.
Some other stats coming out of their earnings report from quarter one, their UnitedHealth Group total revenues were up 7% year over year to $75.4 billion. And Optum total revenues were up 12.9% year over year at $61.1 billion. Ron, just as a final kind of cap on this little discussion here about United and their earnings for this past quarter, how seriously should physicians, how seriously should consultants like us take a look at UnitedHealthcare's earnings, and what does it mean overall for physician reimbursement, for patient premiums and such? What's the point of taking a look at this?
Well, I think there's a couple of points. First of all, I'm an economist. I'm not one of those guys that thinks that no corporation should make profit. In some ways, and I know this will, bother some people, that Gordon Gekko, greed is good, does have some merit to it. A capitalistic for-profit system does produce better results in a lot of areas. I'll give a perfect example. I don't begrudge Apple Corporation the profits they make. They make a fantastic product. I love their product. The fact that they make a better product, in many ways, is why they made those products. So their profit comes in a way that's good for consumers. The concern I have with United and why people should look at their earnings and look at their size is not so much that they made 20-some billion. I don't have an issue with that. I have an issue with how they made it and what they do to make it. They didn't make it like Apple by producing a better product. I don't think anybody could stand up and go, thank God UnitedHealthcare is here. Mm-hmm. Because if not for them, we wouldn't have quality healthcare. They make it at the expense of the consumer and the expense of their suppliers, namely doctors and hospitals. And clearly, I think with their reaction to Change Healthcare, they don't really care what they do to the delivery system. I really don't think they do, in my opinion. I'm sure that people would disagree with that. But that's why we should look at it, because the larger they get, the less they're going to care, and the more impact they can have on the delivery of healthcare in this country. So again, it's not that they make money, it's how they make their money that makes me concerned.
We'll have this report originally published in Becker's Payer Issues in the show notes for this program, and of course at flatlining.net. You're listening to the Flatlining Podcast from Fulcrum Strategies. I'm Matthew Handley. We'll have more when we come back right after this. Welcome back to the Flatlining Podcast. I'm Matthew Handley here with Ron Howerton, the president and CEO of Fulcrum Strategies. Ron, let's switch gears and switch from the economy, which is something that I think we can talk about with a little bit of, this is a fact and this isn't a fact, and talk about politics. But it's still related to the economy, and it has to do with the new $25 minimum wage law for healthcare workers in the state of California. This was passed by California lawmakers back in September of 2023. It phases up the minimum wage to $23 this year, all the way up to $25 an hour in 2026. And it also it takes a little bit slower to go into effect for community clinics and other health facilities, getting them up to $25 an hour in 2027 and 2028. Now, of course, there's the argument here that, healthcare workers, of course, specifically here talking about not nurses and not MDs, they ought to be paid a fair rate. And I don't think anyone would disagree with that. But you and I meet with our clients, our other negotiators and staff members at Fulcrum Strategies meet with our clients, and we know they're all facing a labor shortage right now. Labor is very expensive, and revenues are down as Medicare takes a hit, as payers are demanding cuts. What do you think, just as a big picture, what do you think this $25 minimum wage, as it's going into effect, could do to California hospitals and other healthcare systems there in the state?
Well, economists look at things like minimum wage or anything else that sort of sets a control into what it would normally be a free market economy. Minimum wage says that, says you can't pay below something, even though somebody might be willing to do the job for less than that. And they see that it could have positives and negative outcomes or impacts. Labor costs are one of the things that drive up inflation. Everybody's worried about inflation. Well, labor is one of the things that drives up inflation. Other things do as well. So this could be very inflationistic. Another things that happens when you have higher minimum wage or drive up minimum wage is it will drive up unemployment. As things start to price themselves out, if you will, from a labor perspective, people don't hire for that. It can cause people to go into part-time work rather than full-time work. One of the ways you can help reduce your cost if minimum wage goes up is, instead of having a full-time employee that would get benefits, have two part-time employees and you don't have to pay for benefits. So there's a lot of downside to raising the minimum wage. It'll make things more expensive. It'll make probably some benefits and services not offered. It will drive up definitely inflation. And those are all bad things. Now, there's positives to it. If you're the person receiving that salary increase, that's great. You've got more disposable income. You can buy things. It actually can increase the amount of tax revenue because you can move people into a wage where they're starting to pay federal tax at the end of the year. Same thing with state tax. So it's one of those things, anything in economics has a balancing act. What are the pros and what are the cons of this? Now, I will tell you that increasing a minimum wage to $25 could be pretty expensive. And the cons, the negatives, might outweigh the positives.
Right.
And that's one of the concerns. The other problem with this is, in my opinion, it's different when something happens on a state perspective rather than federal. Because anytime it happens in one state, the concern is, will it drive business out of your state and into other states? Healthcare is less likely to do that because healthcare is mostly local, but it's a concern. Are you going to drive business out of your state and into another state? And that's something all states get worried about.
One of the things that the California Hospital Association was taking a look at was a voter-approved ordinance in the city of Inglewood, which would have barred employers from taking steps like what you just discussed, cutting premium pay, cutting vacation time, cutting benefits and hours and all that. They tried to pass a law there that would bar employers from taking those sorts of steps to offset higher labor costs. It appears that a U.S. district judge agreed with the hospital on March 11 that that was not appropriate and that could not go into effect. It's interesting that we're seeing that pop up, and now that there's a court case saying, no, you can't do that, we're probably not going to see that pop up in any other cities, I would imagine, correct?
Yeah, I mean, when I first read that, there were, and I'm not an attorney, but there were a bunch of attorneys that came out and said that is clearly unconstitutional.
Yeah.
It smacks of a huge overreach by taking any government entity, whether it's a city, municipality, state, or whatever, and starting to put those kind of restrictions on what what an employer can or cannot do, that will get into major problems. Which is why I think it immediately there was a district judge that said that's no way that's happening.
There's a analyst in here who said that she was anticipating that Medi-Cal reimbursements would be increased to reflect those increased labor costs, Medi-Cal being the Medicaid program there, and then said, well, Medicare would eventually at least partially compensate for higher labor costs. Now, that's a lot of, eventually at least partially, which is an interesting way to word that, which Medicare keeps getting cut every year, so I'm not sure how they would think that Medicare would be able to compensate for higher labor costs.
Well, so I think this brings up the inflationary part of it, is to say, well, if we're going to raise labor costs, we've got to raise prices somewhere. You can't just, eat all of that, especially with hospitals that many of them have negative operating margins. Many physician groups are in that same situation. So on the Medicare side, what I think they were referring to is eventually, probably the gypsy calculation on the cost of living part would catch up to it. Now that's going to be down the road, and it probably wouldn't fully adjust for it. Medi-Cal could do it because the state could, increase their reimbursement rates. The state's already got a massive budget deficit. And unlike the federal government, they have a hard time carrying, deficits year over year because they can't just print money.
Right.
So how do you also make that state budget even worse? And if neither of those things happen to cover it, what you will start to see is people limiting or ceasing to provide services to those lower reimbursing things like Medicare and Medicaid. We've seen in some parts of the country, physician-owned private hospitals, they're usually specialty specific, that don't have an emergency room and therefore can avoid taking all or any or some Medicare or Medicaid. We have a real danger of creating sort of two tiers of service or care in this country and having the Medicare and Medicaid fall by the wayside if we continue to put downward pressure on, what hospitals and physicians can do.
This may be a little bit more of a philosophical question, but I'll ask it anyway. California is a very union-friendly state. What's the point of having the unions if the state is going to step in and say we're going to make the pay this minimum? It seems obviously the unions seem to be very in favor of these laws that were passed in California. But I almost wonder if it's not contradictory to be a member of a union and then also requiring the state or having the state require employers to pay more money. What do you think?
Well, so, here's one of the things that can happen. This is all that downstream effect of anything. When you try to mess with a free market economy, you have to deal with all of the ripples of that. It's why economists measure things and they look at things and they say ceteris paribus, all other things being equal, because we know that once you touch one thing, it's like a ripple effect. All right, so let's say the state does increase minimum wage to $25, and I'm paying union dues and going, wait a minute, why am I paying my union dues? Well, that means the union's going to go after that hospital or whoever they're associated with in their contract and say, well, if minimum wage is 25, I need 30.
Yeah.
And so those are some of those ripple effects that, and again, don't get me wrong. I want people to make a fair and livable wage. There's a lot of things about a low minimum wage that I don't like, because I don't like this, the picture of people having to work 2 or 3 jobs and working hard.
Yep.
And not being able to, sustain themselves with rent, et cetera. So this isn't just a cold-hearted economist. It's just me saying that, boy, when you start making these changes, understand there will be downstream effects, and some of them won't be good. It's like the, drug side effects. There's a reason why they're put on the label when a doctor says this is what could happen. So you go into it with eyes wide open. And I think sometimes when people look at things like minimum wage, they don't go into it with eyes wide open on some of the other things that could happen, like increased unemployment and those things.
And finally, Ron, we've talked before, perhaps ad nauseum, about our healthcare equation. You've got, the access, the quality, and the affordability. You can have 2, but you can't have all 3. Which one do you think that this is going to hit the most?
Well, it has the potential of hitting all of them, because it clearly will make healthcare less affordable. If people start reducing staffing or things like that to cover, to make up for this cost increase, it could impact access, it could make quality. So, while this could be great for the people who are working the front desk at a hospital or things like that, and I don't diminish that, it could really hit all of the three negatively, and that would be really bad.
You can find this article. This was published by KFF Health News as part of their California Health Line. You can find that in the show notes for this program or at flatlining.net. Ron, thanks for sitting down with me again today to talk healthcare and to talk economics.
Thank you.
Miss an episode of the Flatlining Podcast? Well, now you can read a recap. Just go to flatlining.net and look right there on the homepage every Monday for a written recap on last week's episode.